Hello, my name is María Fernanda Lorenzo-Gomez. I am professor in the Department of Surgery at the University Hospital of Salamanca, located in Salamanca, Spain. On behalf of my co-author, I am happy to present our work regarding the recovery of labor activity after cystocele surgery during the first ever ICS online meeting. The presenter does not have any conflict of interest to declare. Functional recovery is the physical recovery and functional progression of everything affected by injury, being a fundamental element for returning to the work of daily activity in the best possible conditions, safely and free from pain. The post-operative recovery is completely when functioning is restored and symptoms disappear. It can be assessed by both the physician and the patient, considering hospital stay complications and early organ dysfunction. The objective of this study is to know the factors that influence functional recovery and return to routine life after surgical correction of the cystocele. We developed a multi-center retrospective study of 1,000 women who underwent surgical correction of cystocele. Patients were grouped according to the American Society of Anesthesiologists, ASA, physical status classification system, being slightly more than a half of them ASA scored 2 patients. The variables studied were age, body mass index, evolution and follow-up time, secondary diagnosis, it means concomitant diseases, surgical story, complications that influence functional recovery after the intervention like bleeding, pain and infection. Mean age was 33 years, with a range between 30 to 87. It was lower in ASA1 with 58 years and older in ASA3 with 70 years old. There is a positive relationship between age and time to recovery in ASA1 patients. Older patients needed more time to recover. The correlation was -1 in ASA2 and ASA3 patients. The mean body mass index was 27 with a range between 20 and 42. It was significantly lower in ASA1 patients. There is a positive relationship between body mass index and time to recovery in the 3 groups. More obese patients need more time to recover. Patients in ASA2 group suffered more from high blood pressure, non-insulin-dependent diabetes mellitus, gastritis, dyslipidemia, hypothyroidism, and depression. Patients in ASA3 group also suffered from ischemic heart disease and anxiety, and they presented with a higher number of secondary diagnoses, it means concomitant diseases. In women without postoperative complications, ASA1 patients recovered earlier. 103 patients suffered significant postoperative complications like pain, urinary tract infection, or bleeding. ASA2 patients took in average more time to recover when suffering pain, up to a maximum of 3 months, as well as ASA3 patients when suffering infection or bleeding, up to maximum of 3 weeks. Patients with postoperative pain took more time to recover in ASA2 patients, followed by ASA3 patients. Patients with postoperative bleeding recovered earlier in ASA1 group, but no statistical significance was reached. No significant difference were found in positive urinary tract infections appear. We conclude that 10% of patients present a postoperative complication that delays the return to work life. When complications develop, Age is not related to recovery time, while BMI does. Average time in return to usual activity is higher if there are complications than if there are none. Pain is the factor that delays functional recovery the most, being of worse control in patients of ASA2 compared to ASA3 or ASA1. Thank you very much for your attention.